Dr. Peter Marks, who is the director of the Center for Biologics Evaluation and Research at the Food and Drug Administration. Dr. Marks, thank you so much for being with us this evening.
My pleasure.
In short, you are the person who is responsible for approving new vaccines and drugs, the perfect person to ask this question from our audience. Why should we trust the process used by the FDA to approve these vaccines? What exactly is that process?
So the FDA uses a rigorous process when we go through our applications. And in fact, it just picks up on what the discussion was just before. We follow the science. We look through the information that's provided. We understand the way the vaccine is manufactured, the components to go into making the vaccine, how it's made, the quality measures, what's used to make sure it is what it says it is, that it's pure, that just is not containing anything strange inside the vaccine. We take a tremendous amount of pride in doing that, and we've done that for more than 100 years, having existed even before the FDA existed. Our center goes back to the Biologics Control Act of 1902. So we've been regulating vaccines for a while. So we make sure that the vaccines are made well. Then we look at the data on how well the vaccines work, how safe they are, and we make sure that there are plans in place to monitor if there are any problems that are going to come up with the vaccines in the future. And at the end of the day, that's done by a team of scientists that's a diverse group of people that brings a lot of different expertise to this, and usually involves dozens and dozens of people, and they come together to put together an integrated review. At the end of the day, the one thing that really joins them all together in doing that is that they think of it the same way. They don't want to approve anything that they wouldn't want to put in their own arms. And so that's how we go about this. We follow the science, and we make sure that the data support the decisions we make.
Well, thank you, Dr. Marks. Going on to our next question. Were there African-American scientists involved in the approval process? And what about sufficient numbers of African-Americans actually being included in the clinical trials to make meaningful recommendations?
Yeah, so I'm very happy to say that we have a very diverse center that is at FDA. There were indeed African-American and other minorities that were involved, underrepresented minority people who were involved in this. We have a diverse group that works on vaccines, and that's important because everyone brings a different perspective to this. In terms of the clinical trials for the two vaccines that are now under emergency use authorization, the Moderna and the Pfizer vaccines, both of those had just under 10%, 9.8 for one, I think 9.7 for the other, close to 10% people who categorize themselves as Black or African American. So a reasonable number, kind of consistent with the population, which was very important because of the disproportionate way that the Black African American community has been adversely affected by COVID-19.
Well, let me go on and ask questions about three special populations. Women who are pregnant, individuals who are immunocompromised, and what about children? What about very young children, infants? Should they all get vaccinated?
Right. So let me take them one at a time. So, and actually, the immunocompromised and the pregnant women are ones that are actually kind of similar right now. For pregnant women, we had some pregnant women in the trials, but not enough to make a definitive statement. That said, the way we have put forward for providers the information on this is that every provider that wants to consider administering a vaccine to a pregnant woman should have a discussion of the benefits and risks, because the risks of COVID-19 to a pregnancy are pretty significant. So there's no issue with vaccinating pregnant women with these vaccines theoretically. And in fact, I can tell you that hundreds of pregnant individuals have decided to get vaccinated. Those were at least several hundred healthcare workers who were pregnant decided to get vaccinated, as well as additional people. So pregnant women, it's a discussion with your healthcare provider about the benefits and risks. And the same really goes for immunocompromised people, where there the issue is that we're not quite sure how good an immune response a person with immunocompromise will make. And it's probably different because not all immunocompromised people are immunocompromised to the same extent. Nonetheless, the benefits of getting the vaccine may certainly outweigh the risks. And for children, this is a challenge for us. We still don't have data on individuals younger than 16 years of age. We're right now seeing studies that are getting started to look at adolescents, and then after that, there'll be studies in younger children. So right now, we're in a place where we can't recommend giving these vaccines to children until we have the data. So that does mean that we still have to take the precautions with our children, but hopefully within the coming few months, we'll start to get those data and then be able to have vaccines that we can give to children.
So here's a question that's come in from our audience. What are your thoughts about the role of vitamin D in preventing or treating COVID-19?
So I'm not an expert in this area, but I would say that we don't have any great evidence that that's an effective treatment for this. Probably what I could say is a good, healthy, if it's vitamin D supplementation in the context of a healthy lifestyle where you're getting enough sleep, getting enough to eat, and taking good care of yourself, and taking social distancing, mask wearing, hand washing precautions, then it's probably fine. But that's there are not that many treatments that we know for a fact work. We know that there are some monoclonal antibodies. Those are antibodies against a specific molecule those can be effective. We know that there are a few others that seem to be promising, and we know that convalescent plasma may have some benefit. But there's not a tremendous amount that it's not like that I can say to you that we feel confident in the vitamin world that is going to help.
Well, let me ask one last question, Dr. Marks, and this is a big one. It comes from an audience member. I am worried about anaphylaxis because I am allergic to shellfish and have seasonal allergies. Should I get vaccinated?
That is a fantastic question. That is one where when you go to get vaccinated or you go to the provider considering vaccination, you should tell them about that shellfish allergy. Shellfish allergies are not a reason not to get vaccinated. It's why, though, we have all of the providers that are giving the vaccine right now are prepared to deal with allergic reactions. And you should tell them so that they might take a little bit more precaution, but having a shellfish allergy is not a reason to not get vaccinated. It's a reason for the provider to know about it so that they can probably watch you. The Centers for Disease Control would say they'll watch you instead of just 15 minutes. They'll watch you a half an hour in the office. But it's not something that would prevent you from getting vaccinated. Right now, the only things that would prevent you from getting vaccinated is if you had a known allergy to one of the things that are in the vaccines, or if you'd had an allergy to a bad allergic reaction to the first shot.
Well, thank you so much, Dr. Marks, and we will now turn things back over to Dr. Reed Tuckson.
Well, thank you also very much, David, Dr. Carlisle, Dr. Corbett, and Dr. Marks. Dr. Marks, you've always been with us for every show, and we appreciate you again today. A big issue that is in front of all of us now is now that we have these vaccines is how will they be distributed? We have the two people who have the most prominent roles, perhaps of all, in getting this done. Let me introduce first Major General Christopher Sharpston.
BlackDoctor.org, where wellness and culture connect.